Good afternoon. I'm Chip Partner, Assistant VP for Communications at the University of Rochester Medical Center. The second and final group of emergency medicine providers from Medicine's Strong Memorial Hospital returned Sunday from the front lines of the COVID-19 pandemic in New York City. While there, 14 physicians, physician assistants, and registered nurses supported Northwell Health medical staff for nearly a week and also gleaned valuable insight that can be shared across our own community. Today, we're joined by Dr. Mike Kamali, Chair of the Department of Emergency Medicine, and Rebecca Stott, a nurse manager for emergency medicine, And Dr. Kamali, did you want to say a few words about the trip?
Sure. So several weeks ago, under the governor's request, we started to identify people that could potentially deploy to New York City to assist in the outbreak and the patient loads and volumes that we were having there. We sent out a message amongst our emergency medicine staff as to who might be interested, and we had an overwhelming response. Coordinated that with the leadership here at Strong Hospital and the University of Rochester, and deployed an initial team of 14 people that were there for about a week, followed up by a second team of 14 people that were also there for a week that were returned this past Sunday. We've gained a lot of information, but more importantly, our people were able to help in the New York City area and also learn a lot of information while they were there.
Thank you very much, Dr. Kamali. And first to sign up today was WXXI News with Max Schulte. Max, do you have a question for Dr. Kamali or Rebecca Stott?
Actually, I'm just recording, so I don't have a question. I'll just kind of piggyback off what you guys have to say. Thanks.
Did you want to plug the research forum that Evan Dawson is hosting tonight at 8 o'clock on WXXI? Featuring 4 faculty members from the University of Rochester Medical Center.
Chip, you're probably better at doing that. Why don't you
Just thought I would mention it. I know the feed is available to all the broadcast stations in town. Next to sign up was Spectrum News. Do we have a reporter on from Spectrum? We're unmuting Spectrum. Nobody asked a question. The PR guy's going to ask a whole bunch of softballs. Anyone from Spectrum? All right, next to sign up was WROC TV Channel 8. Do we have a reporter from Channel 8?
Hi, can you hear me?
Yes.
Hi, so my question is for Ms. Stott. So if you could talk a bit about your experience, helping out, what specifically did you do? What was your role? And sort of what did you witness while you were there?
Sure. So when we arrived in New York City, the team of us started out at the hospitals. We were all divided into 3 different hospitals. We went to Long Island Jewish, Valley Stream, and North Shore Hospital. For me particularly, I went to the ED for a couple days, sort of watch their process, how they sort of triage the patients that were suspected COVID and non-suspected COVID. We learned a lot from that just from triaging with our own tent. From the emergency department, we went to the, they have their recovery room set up as a COVID unit, and we sort of helped out there. We just sort of jumped right in and started helping the nurses. I mean, they were a little overwhelmed for the past couple weeks, so we were getting there just as their peak started to flatten out a little bit. So we were able to relieve them for breaks, just sort of maintain the patients, just sort of being there to help them out emotionally and giving them some to just step away, which is what they really needed.
Sabrina, did you have a follow-up?
Yes. So in terms of, what specifically your interactions were with patients, if you could talk a little bit about that.
So most of the patients in the unit I was in, they were all on ventilators. I think there was about 20 ventilators in the unit I was in. It was very crowded. It was a very, the staff were very caring for the patients. They sort of humanized all the patients. All these people were on ventilators, so you didn't really get a chance to know the patients themselves. So what one of the doctors did was he had taken the iPad and he had talked to the family and he said, tell me something about your family. Tell me something so I'm not just taking care of a body, I'm taking care of a person. And, you know, some of the families would share things like, you know, what their name is, how many grandchildren they had, if they like to garden, what they like to do. And they really humanize each patient there. So I was very impressed at seeing the staff and how well they interacted with their patients.
And thank you very much, Rebecca. Next, 13 WHAM TV. Is there a reporter on the line, or are you just rolling on this? You're unmuted on 13. All right, Sabrina, we'll come back to you in a minute. A question I'd like to ask both Dr. Kamali and Rebecca is, I know one of the purposes for going to New York City was to learn things that we might bring back here if there were to be a surge in Rochester, which we're hopeful is not happening. But maybe Dr. Kamali, because you've overseen both of these visits, what are some of the takeaway learnings that we brought back?
So as we had heard from other areas around the world, and then specifically in New York, was that a surge of patients can put a tremendous strain upon the hospital system. And what we tried to do across our system was to create space and capacity on both the floors and in the ICUs, and then look beyond that for even excess capacity. From the standpoint of the emergency department, what we also looked at was the flow of patients, how we would get those patients into the department, get them taken care of, especially if there were critical needs, and then move them out of the department. The experience in New York provided a lot of insight into that, as well as some specific things related to intubations. That is a procedure that can be aerosolizing and is of great concern that it might spread COVID. So we learned things related to that, as well as other things to protect our staff and protect the patients.
And Rebecca, you're a nurse. As a nurse, what did you bring back that if we did have a surge in Rochester, what kind of things would you do differently? Or
Yeah, I think to piggyback on what Dr. Kamali said, I mean, just sort of preparing for the surge if we did have it, the tent, trying to keep the patients that we think are more COVID positive outside, just preparing the staff emotionally and what to expect when those patients are coming in, expecting that patients may die and we may not be able to help them. So it really to resonate that among the nurses that this could be a possibility and it could happen here in Rochester.
Thank you both. And Sabrina, if you've got additional questions, I think everyone else is rolling tape, so you can kind of treat this like your own interview and ask away.
Sure. So I have, another question for you, Ms. Stott. So when you were first approached, or when you first heard that they were looking for volunteers, what sort of went through your mind as you were deciding whether or not you'd go ahead and get involved with this?
Well, personally, I said sign me up, but I thought maybe I should ask my family that that I live with, that I may be putting myself in a vulnerable position. So they just knew it was the right thing for me to do. They know when I get up in the morning and I put my scrubs on and go to work, I'm going to do the very best I can. And they knew that if I went to New York City, I was going to do the very best I can there, whether it be for the patients or the nursing staff.
And so I understand, was this a letter that sort of went out to all nursing staff at the hospital, or sort of how did that work?
I think it came through our leadership team, and they sort of sent out looking for volunteers. As the manager of the department, I thought it was a good place for me to go. I really needed to know how to manage this. I've never managed a surge capacity before, and I've never seen anything like this. I've been a nurse in the emergency department for 23 years. So this is something that was new to me, and it was something that I think it was important to experience.
Dr. Kamali, we might direct that same question to you, because I know you brought this idea to medical center leadership several weeks ago, just how this all came about.
Sure. So when things were unfolding in the New York City area, here in Rochester, we were fortunately relatively calm. And a lot of our staff came forward and said, how can we help? And they requested to go to New York. So I approached medical center leadership and said, we have teams of people that are ready to deploy, ready to go to New York City and help. How can we make that happen? And very quickly, we put our heads together and we made that happen. The two teams that went down we're exclusively emergency medicine, as we thought that would be the first and operationally the easiest to get off the ground to get there, and those that could easily assimilate in and provide a lot of support to the hospitals and the people down there. So that's how we were able to lift it up, get them down there and make it work and make it go. And at this point, now that things in New York have stabilized somewhat, hopefully beyond the peak and starting to calm down a little bit, we remain ready here. And we see people, if the need arises somewhere around the state, around the country, available to help, but also remaining vigilant here at Strong and in Rochester.
Thank you, Dr. Kamali. And Sabrina, we can come back to you, but Max Schulte at WXXI said he would like to ask a question. So Max?
Yeah, and you know what, I think you briefly touched on answering my question at the end of the answer that you just gave, but you know, we're moving into a new world order, so to speak, and you know, we've watched the governor shift resources from upstate to downstate to western New York. Looking ahead, you know, possibly to the fall, if there is a resurgence and strengthening in the virus or mutations in the virus, how are plans evolving to handle these resource shifts and identify, you know, throughout the state's medical system for you guys to be able to address shifting resources quickly or being able to move, you know, nimbly to address shortages within the state? Is there something coming around that, you know, is new to handling this?
Well, I think that's a great question, some great observations, and a lot there. So I'll try and tackle all of it. So as each day goes on, each day, each week, and now getting into months, we're learning more and more about this virus, as well as learning more and more about ourselves and our capabilities. So we have to be ready for whatever might come about, but we also have to take care of patients that need ongoing medical care. So we will have to be ready if there is a resurgence in the fall or a second surge or second wave. We'll have to be ready to handle and manage that, and we will be. We've learned a lot in this time, and we'll understand where we can put people, what we can manage, and if there's a need to deploy our staff to other areas within the state, we can pretty quickly do that, assuming that we can maintain enough of a force here to manage what is thrown at us at any point in time. For our staff in emergency medicine, we're a little bit unique in some ways, that to some respect, you can plan us in pretty much any emergency department around the country or around the world, and it's fairly natural. It's a natural fit. The computer systems might be a little bit different, but that care of the patients is relatively the same. Now, the other piece that's really important is we're moving into this next phase that I'm referring to as the normalization of COVID. The COVID becomes, it's there, it's another medical condition along with the multiple other medical conditions that we deal with on a daily basis. How do we manage that side by side with other conditions? During the past month to 6 weeks, we've seen a big decrease in our volumes of patients coming to our urgent care centers and our emergency departments. Those patients are still there. They're just staying at home. They're avoiding health care for fear of COVID. But when you take a look at our staff and our departments, we've done a very good job of protecting our staff and protecting our patients. So the emergency department and the urgent care centers and the rest of the hospital are very safe places to be. So we really want to encourage those that need medical attention can come into the hospital, can come into urgent care, can come into the emergency department, or use the telemedicine option so that they can get the care that they need. I am fearful that people are avoiding the care that they need and not coming in for fear of COVID. But as we get to this normalization phase, COVID is another process that we'll deal with side by side with everything else that is always going on.
And Max, to a couple of points in your question, the one reason that emergency medicine central to New York City was Governor Cuomo requested. That was, I think the first group went as the peak was approaching, and the second group just right as it was passing over. So we sent 28, 29 people to just help out as the governor requested. You asked about the ventilator rationing. Just to be clear, no ventilators were ever taken from our medicine hospital. There are some set aside that could be donated if there's a peak in another part of the state. And Dr. Pastelaka said yesterday we've got more than 70 ventilators unused right now as we're kind of in a steady state of the number of COVID patients at Strong Memorial and our other UR Medicine hospitals. Sabrina, did you have additional questions?
Yeah, I'll just follow up on something I asked Nurse Stott before, but with regard to your decision to, again, go ahead and volunteer, you know, people in the public, we really look at you guys as heroes, and I sort of just want to talk about, again, that decision. Were you at all concerned for yourself and your own safety when you decided to go ahead and get involved?
I would be lying if I said I wasn't concerned, but I was concerned. But like anything, I approach it with caution, and I'm educated enough to know the proper PPE. And I felt supported by not only Dr. Kamali and the staff here at the U of R, but also when we stepped foot into Long Island Jewish Hospital, they were very supportive of us, and we were given the appropriate PPE. Once we did that, I felt very comfortable.
And you had the appropriate PPE, all that equipment. You didn't experience necessarily a shortage when you were there.
No.
Any other questions, Sabrina?
As far as questions on my end, I think I am good.
Rebecca, I'll ask, was there any one patient or one staff member that stood out to you that maybe you bonded with, or any, you know, anything that personally affected you from your visit down there?
I think there was a couple different things. First of all, one thing they did was they discharged their 1,000th patient that was diagnosed with COVID from LIJ, so that was pretty impressive. Another thing is when I was working with one of the nurses in the recovery area, or the PACU, their COVID unit, I asked her, I said, how are you doing this every day? And she turned around and she said, we just do what we got to do. And they just worked together, and they just bonded, and they became such a team there. There was nurses that didn't work in that unit. There was pediatric nurses, GI nurses, med-surg nurses, but they all came together just to take care of the patient, and that was really the most important thing at the end of the day. So they all stood out to me.
And while we're not quite to 20 minutes yet, Dr. Kamali, I'd like to follow up on a point you made about people coming to our urgent cares. Maybe you could talk about steps that the emergency medicine department has taken to make sure that the staff members are safe and the patients will be safe, whether they come in for COVID testing or a broken bone or a skinned knee.
Sure thing. Great question and great point. So if you take a look back and you go back just even recent history, we've always have dealt with infectious processes. C. difficile is an infectious process. The flu is an infectious process. We've had other infections that are prevalent within our environment and within our departments. So we've constantly been trying to aware and isolate patients who might have those diseases or who may be susceptible to those diseases. So the combination of trying to identify and isolate, as well as maintaining a very clean environment where things are wiped down and where people are washing their hands and using gloves, goes a long way. Now we've elevated it to another level that we have our staff and our patients in masks, and many of our staff in special PPE so that they can safely manage patients, and we can do so for any number of patients in our environments. And I suspect that that's going to continue for a long period of time to allow us to manage any patient that comes in.
Any final thoughts that you, Dr. Kamali, or you, Rebecca, wanted to share about your visit?
No, I just want to say that I was so impressed with the staff at LIJ, the particular hospital I worked at in New York City. Just came together, and they just did it. And sometimes I feel like that's what we do in the emergency department here at the U of R. You just do it. That's very unique to emergency medicine. The staff were great. They were really great, and they were just glad to see us and just glad to have our help.
And Dr. Kamali? Well, if anyone wondered whether this is live and we're really in a hospital, there's a page interrupted.
Right.
Actually, because what was I hate to ask you to say it again, Rebecca, but that's wonderful what you said, and I think our TV friends will hear it as you try again.
Oh, sure. I just talked about how amazing the staff were down there. I was very impressed at their dedication, just at the compassion they had taking care of the patients, and just how they welcomed us, and they were just really glad that we were there to help them, whether it was to relieve them for a break or just to talk to them for a little bit. I think really appreciated us being there, and it felt good to give back to them. So I was appreciative for the opportunity to go.
And before Dr. Kamali closes, we should say you and your colleagues gave us some pictures that we've shared with the media folks. And one of them was balloons at Long Island Jewish that I think formed a thing of the number 1,000, and that was after they discharged 1,000 patients. And I know we've celebrated, we just discharged our 125th patient healthy after being treated for COVID here. Maybe you could say something about were a celebration when patients were discharged, or how did that work?
I think it's important for healthcare workers to celebrate those wins, because while we were there were so many deaths, but to celebrate the wins, I think was good for them, for their souls. The patients left, so they sort of formed a line and everybody sort of clapped and the patient went out. Another thing they did do at Long Island Jewish is every time they extubated a patient, they overhead played Here Comes the Sun by the Beatles, but everyone would stop in the unit and clap, because again, they needed to celebrate that win, to feel like what they were doing was important.
Great. Dr. Kamali, any final thoughts you'd like to share?
I'm just so fortunate to work among some really, really great people who are just passionate about their patients and their community. So we're fortunate for our ED nursing staff and our many others who are always there.
Well, thank you both very much for the service that you provided and for joining us today. Thanks to our friends in the media for joining us again. And we'll be back next Tuesday probably at 1:30 p.m. I am going to give a final plug to WXXI for a live forum on the science and research behind COVID-19. That's airing at 8 o'clock tonight live on channel 21 and on 1370. So thank you, everybody, and we'll end the meeting.
Physicians were at Long Island Jewish, 2 nurses were at Long Island Jewish, 2 of them went to Valley Stream, and 2 of them went to North Shore.
So 2 nurses at each of the 3 hospitals.
Correct.
Do you know of the other providers where they split third to third like that? Or?
No, the providers worked at Long Island Jewish.
So it's 2 nurses at each of the 3 hospitals, and the physicians and physician assistants were at which one?
Long Island Jewish.
Long Island Jewish.